Next, I'd like to have Dr. John Whyte come to the stage. He will be talking about symptoms to solutions, partnering with your clinician for heart valve health. Dr. John Whyte is a physician, author, and chief medical officer at WebMD, where he leads efforts to create meaningful change in public health. He plays a pivotal role in evolving digital platforms to connect people to care, and author of multiple books which encourage people to take control of their health in a positive way. Previously, Dr. Whyte served in leadership roles at the U.S. Food and Drug Administration, Discovery Channel, and the Centers for Medicare and Medicaid Services. A board-certified internist, Dr. Whyte continues to see patients and holds an MPH from Harvard University. Thank you, Dr. Whyte, for joining Rock from the Heart and sharing with our audience ways to navigate their health and healthcare in the modern era. Please welcome Dr. Whyte.
Well, thank you for that very kind introduction. And I really have enjoyed the conversations that I've been hearing, especially from Karen and Dr. Jensen. And I have to tell you, really the theme that they talked about that I'm going to talk about is empower yourself with information. Advocate for yourself as a patient. Ask questions. That's really what we need to think about as we think about heart disease and heart valve disease. As mentioned, I'm Dr. John Whyte. I'm the Chief Medical Officer at WebMD, and I'm also on the Board of Directors for the Alliance for Aging Research. And some of my colleagues from the Alliance are here with me today helping put on this great conference. And they've been supporting Heart Valve Disease Awareness Day, which is always held on February 22nd and started in 2017. And I'm delighted to say I've participated in the majority of them, not all of them, but most of them. Because like many of you, I'm interested in heart disease. I'm interested in how we educate patients. I mean, I feel like I might need to get a whoop soon. I don't know how you feel, but data is important. And that's what drives decisions. So it's really a privilege for me to be with all of you today, and I'm going to stay through the weekend because when we talk about heart disease, we talk about valvular disease or arrhythmias, we have to remember that with all of these diagnoses, there is a loved one behind this diagnosis, a shared experience, and we really need to keep that in mind. So what I'm going to talk about is heart valve disease. Remember, the heart has several valves in terms of how the heart pumps. And many people may not be aware of valvular disease, but it impacts more than 1 million Americans. 11 million Americans are currently with heart valve disease, and 25,000 people die from heart valve disease every year. And one of the most common forms, you might have heard about it, aortic stenosis. There are some other types of conditions. You might have heard mitral stenosis or aortic regurg. But when you think about it, it affects nearly 1 in 10 adults over the age of 75. And we put out these numbers, but remember, behind these numbers are people. And we can't forget about that because they're our friends, our spouses, our loved ones. And while these are big numbers, 11 million people, 25,000 people die every year, there's really an underappreciation and an underdiagnosis of valvular disease. And I would say these numbers are probably even bigger. I wish we had a Fitbit, an Apple Watch, a Whoop that could detect valvular disease, but we don't. I am going to tell you how we do detect it, but that's especially concerning when we think about underserved areas, when we think about minority populations that often don't get as good care, and that also is in diagnosis. So often the symptoms, you may say, well, Dr. Whyte, how would I know if I have valve disease? Because some of those symptoms can be fatigue, right? You're tired. You might have some shortness of breath. You may think, I'm just getting older. I'm just slowing down. And you don't think, hey, maybe I need to get checked. And that's what we want to change. Now, for those of you that have gone to the doctor lately, maybe the primary care physician, not the orthopedic surgeon, I'm not sure if they still have stethoscopes. I don't know if any of my ortho friends are here, but when was the last time at your last appointment, show of hands, that the doctor actually placed the stethoscope on your chest and listen to your heart. Okay, so not everyone, right? And a lot of doctors aren't doing this, or maybe they've done it once, and they don't feel like they need to do it again, or that's not what you came in for. But that's really the first step in detecting valvular disease, a simple stethoscope exam. And sometimes people think, well, I've never had this thing called valvular disease. Do they need to check? And we know that as we get older, valve disease increases because our valves may not have as good function, they may get stiff. So we really need to check for what we're calling a murmur, this unusual sound that we hear by the way that the heart is pumping. And that can be one of the first signs of trouble. And unfortunately, as I mentioned, many healthcare professionals, they moved away from doing it. They're busy, they have a lot of things going on. That's not what you came in to talk about. And that's a concern because sometimes those symptoms can be overlooked. And we have a simple test to check for it. And while we have done a bit to improve awareness over the last 9 years, the fact is that when most people think of heart disease, what do they think about? They think about heart attacks, right? And that is concerning. And we need to do better at managing heart attacks, and we've done better. But the same is true for valvular disease. One survey found that as many as 3 out of 4 Americans, 3 out of 4 know little or nothing about heart valve disease. How many of you have heard of heart valve disease? Have you heard of aortic stenosis or mitral stenosis, aortic regurg? And that's not a bad number, but we should have everyone here has heard of heart disease. Everyone here has heard of atrial fibrillation because we've done a lot to educate folks, but we need to do more. We can change that. We can take steps individually as well as a community, and that's why it's great to see so many people together to get better care, to get better outcomes. But it starts, with diagnosis and advocating for ourselves. And some of you may think, well, Dr. Whyte, and I think of Karen's comments, people want to be a good physician, a good patient. They don't want to challenge the physician. And you might be thinking, can I say to the doctor, maybe you should listen to my heart? Sure, you can say that to the doctor. And if the doctor gets offended by you saying that, you should think about getting another doctor because you need to be your own advocate. You really need to empower yourself. Now, some of you are laughing. I'd love to hear what you're talking about after this, whether you really can say it to your doctor, but you should be able to, right? You need to advocate for yourself. And if your doctor has never listened to your heart and it's a primary care physician, I would argue there's a little bit of a problem there. So really, the key to successful outcomes, as I've been saying, is early detection and treatment. And that's really what we want to think about. We do have new research that's making the case for early intervention. If you have severe aortic stenosis, and even if you don't have that many symptoms, we know that early intervention is going to lead to better outcome. And we've had multiple studies that have shown this. Multiple meta-analyses, which is an analysis of several studies, have shown that early intervention, and we see this with a lot of diseases, is key. And that's what I want you to be confident of, that we have better solutions nowadays too. We didn't always have that. It always had to be this open heart surgery. You need your chest cracked to repair your valve. Now we have different procedures and different strategies. So that's always important to know, that if you get the diagnosis, what are your options? So this is the point about your voice matters. And you always want to go to a conference like this and, what are your take-home messages? What are you going to learn? What are you going to tell your friends? I'm going to look at Whoop and maybe a few other things, but what are you going to learn from that guy, from WebMD and the Alliance that told you about heart valve disease? And at WebMD, our motto is that better information leads to better health, right? And that's what I want all of you to have, is good information. And I want you to advocate for yourself. I want you to advocate for your own health and know your medical history. Because with many diseases, there are some genetic components. And sometimes it may feel troubling to ask relatives, what did Uncle Joe have or what did Aunt Mary have? But if you do have a family history of valve disease, That's important to know because screening is going to be even more important for you. And remember, a lot of times we lump all heart disease into heart attacks when they're not. So that's the first thing. You need to be proactive with follow-up and ask questions. I loved Karen's point when she said you want to call the office and you want to be nice to everyone. And I still see patients, and I said to people at my table, if they answer the phone when you call the doctor's office. So I get it. It can be challenging. And you want to be nice, but also, sometimes the squeaky wheel does get the grease. I'm just, pointing that out. So you want to do, as other speakers have said, you want to do those ABCs. You want to be proactive. You want to go to sites like WebMD, and there's lots of other good sites, to empower yourselves with the questions that you should ask in terms of, might I have valve disease? Why am I more tired now than I used to be? Why do I have swelling, in my legs? We know that it increases with age. And I don't want you to think, as I see many patients that do, that think it's just a normal part of aging. Sometimes it is an important part of aging, but other times it's not, and it's valvular disease. And if you don't ask the questions and don't bring it up, then you'll never know. And I'm going to tell you something that a lot of doctors don't like, but I would do it when I would go with my mother to the doctor, and I do it to myself when I have questions. You bring your list in, or you have it on your phone, and you don't leave until you get all your questions answered. Even when the doctor wants to, put their hand on the doorknob, you just stay seated. What do? They come back in. If they don't come back in, then they're very rude, and you really should find someone else. But you want to ask your questions. That doesn't mean that you need to have, a list of 20 questions for that visit. That might require another visit. But you do need to educate yourself prior to your doctor's appointment. And as I said, there's lots of good resources out there. And that's about being informed and doing your own research. And there's a lot of great community sites online as well, in terms of Facebook and other pages that can give you more information. And we know that shared decision-making is going to improve health outcomes. And that's what's really important about it, in terms of, if you get the diagnosis, you want to have a good outcome. So in terms of, as I mentioned, a lot of places on the internet, you want to get information. And this is just a little bit about, we're running a little, short on time, about how the heart works in terms of those different valves and how they could have an impact. But those are some of the things I want you to think about as to how you can empower yourself with more information. Because your relationship, I'm joking, but your relationship with your healthcare provider, your primary care physician, perhaps a cardiologist, it really is about a partnership. And that might be a new way of thinking for many people. It was mentioned, early on that we hold teachers and doctors and police officers at this very high level. Honestly, I wish that was true. It's not always true nowadays, but you're your own expert. And that's what I always say to patients. If you feel that something is wrong, you know your body your best. If you're having trouble breathing, you're feeling fatigued, then you need to get it checked out because something might be wrong. And when it comes to valvular disease, you have to have someone listen to your heart. That's the beauty of it. That's how we find out. And I'll tell you, sadly, we're not teaching as well as we did in the past about using the stethoscope and listening to the heart. And luckily, we have more, diagnostic tests such as an echocardiogram that you would use to know for sure. But these are the things that you need to be thinking about. And what I love is that there is a sense of community. There is advocating for others when we talk about valve disease. Because when you talk about your experience, whether it's on social platforms or old school one-on-one today, as you can be at tables, that's going to empower others and influence others also to share their experiences, or also to think about their own health and their family's members' health as well. You want to have conversations with your family and friends. You want to talk to your loved ones, and you can tell your parents or your spouses. I heard Dr. Whyte from WebMD, and he told me to go with a list of questions and not to leave this office until all of them are addressed. but that's what's going to empower you, because your participation and even more so advocacy can help save other people's lives. Because there's a lot that needs to be done at the doctor's appointment. There's a lot of research that still needs to be done. We need to advocate to address valvular disease, to really figure out how we screen people more effectively. How do we educate patients, but how do we educate clinicians? Because the other point I want to emphasize again, you may say, well, I've never had valvular disease. I hear that a lot of times from patients. Or, they put a stethoscope on years ago. I didn't think I needed to have that done all the time. But if you're having a change in symptoms, or you're having some subtle symptoms and you've educated yourself, then that's an important step. And you have to ask your doctor about it. So that's why it's so important, to empower yourself. You want to get involved, you want to visit valvediseaseday.org. For those that you are on X or Instagram, we have the hashtags that I want you all to think about and promote. And as I said, I'll be here, for the next few days. I'm always happy to answer questions one-on-one as well. So it's all about empowering yourself, learning the signs and symptoms of valvular disease, making sure that your doctor listens to your heart and checks for murmurs, and then if you do have one, learning what the options are for you or a loved one. And with that, I think I might even have given you back an extra couple of minutes. So thank you very much.
Thank you.